dealing with these victims,
Uh-huh.
what type of training did you have? And you know, I know that for me, we've been trained to kind of separate yourself from, well, sort of, you know, trying not to get too emotionally attached to these guys. But was that pretty difficult, trying to stay more of a neutralized point of view when you're dealing with such traumatic experiences with these
That's
victims?
a great question. Let's see. Let me think back. First, I think before I worked with the hotline, while we were stationed in Guam in the like 79 to 81 time frame, I was a nurse, okay, but I was volunteering with the Red Cross, and because I always wondered, well, what happens if there's a disaster? And certainly living in Guam, we had earthquakes and typhoons all the time. So, you know, what do you do if something happens? So I became part of the disaster nursing committee. Okay, so this was my sort of intro into the whole thing. But actually what happened was that when we were stationed in Guam during that time, my youngest brother, who's 10 years younger than me, was also stationed in Guam. And there were two different units, so he didn't work with my husband, he worked in the other office. But a friend of his was raped by another Coast Guard person in the barracks. And, you know, I was a nurse, and I thought, oh, they'll help her, they'll help her, you know, make sure she's physically okay, they will help her through the criminal justice process. And then I realized how naive I was, that it was very traumatic for her to go through that, because at that time especially, and I think it's even, it's not as bad now, but still pretty bad, there was so much blaming of the victim. And so that was my impetus to join the rape hotline when I got transferred the following year. So we started out with a 40-hour training program of all different kinds of subjects. And so that was the first thing. But your other part of your question was, how do you prepare yourself to have this sort of detached empathy? And it's something that many young people, when they first go into a profession, you know, you go into a profession because you care or you want to help people. You don't go into a profession to do all the paperwork and feel tired all the time, but that's what ends up happening. You become emotionally drained, and so at some point you have to make the decision that if this is something that you want to pursue, if this is something that you want to stay with, you have to separate it, draw the line, and say, this is a terrible situation, but it's not my situation. And so you don't have to go around feeling really horrible the rest of the day because somebody else has this situation. Think about it. If somebody's in trouble, would they want to be in that situation themselves? No. So would they want somebody else to feel just as bad as they feel? Not really. So you have to learn to make that separation. And it takes a little practice, but you know, pretty much, I mean, I work with bereaved people a lot, and I can be there, I can be present with them, I can listen to them, I can give them the opportunity to talk about what they're feeling, what they're thinking, what they're going through. If they need help solving a problem, I can be a sounding board, I can help them see their options. But when they get up and walk away, I might think later, that was a tough situation, but I'm not going to feel bad the rest of the day. Or think about it, you have a client coming in right after that person leaves. If you're so caught up in feeling how bad you felt for that person, how can you possibly be present with the next person and give them what they need? Does that make sense? Yeah, so you learn how to do that. You have to survive. Yeah, because burnout is a significant problem in the helping professions. Yeah, you have to take care of yourself. Good question.
Is it hard to find a job once you graduate? Like, is it like, even if you're going for like nursing and you need to have a medical field, is there a chance that you will be like unemployed right after?
I've seen nursing kind of come and go in waves, to where there were a lot of nurses and then there were very scarce nurses. So it really depends on the job projections. So if you're interested in a particular type of medical job, I would go online, I would talk to people, I would talk to the people in the hospitals, in the nursing office, in the recruiting office, you know, for each specific profession, get their input, see what they think, see how they see it laying out. But I'll tell you now, people my age, we're the baby boomers, we're the ones who are gonna be in the hospital, and there are a lot of us. Okay, so I would say your jobs are probably secure for a while, but, you know, it really depends on which specific area. I would say nursing is too.
And would that job be more in demand in like military, or like overall just?
Yeah, again, I would talk to nurse recruiters at the military hospital, only because they're talking about downsizing. Okay, so that would be the concern. And so with downsizing, of course, budgets go down, and then people being hired go down. So it really depends. Yeah. Are you thinking of going in the military?
As a possibility.
Yeah. It's a good career because you can get into it, good job security.
Either like
retirement.
medical field for me, either like pilot, like stuff, like Air Force One.
Coast Guard. They have pilots. They have pilots.
In the Coast Guard.
Yeah.
Yeah, they're pilots.
And the good thing about the Coast Guard is you don't need to have a formal, what's the word? You can apply to the Coast Guard. You don't need
Yeah,
a
you don't
letter
need your-
from the senator like you
Yeah.
do in the other services.
You need like a official letter from them. Like
Would you need to
recommendation.
pass the special tests like they have?
I'm sorry, what?
Would you
ASVAB.
like
The
ASVAB?
ASVAB.
Do you need to pass that to be a Coast Guard to like work there?
I've heard that term, so I'm thinking yes.
ASVAB is like the test.
Yeah, the test that they take
Yeah,
for
you
the
do.
military.
Probably.
Yeah,
Yeah.
I think you do.
Yeah. Yeah, but I'm sure, they're always looking for good candidates, so, yeah, I would talk to them. And then the Navy uses public health, so that's another avenue too, if you wanna be in the uniform service, but not affiliated with a specific service like Navy or Air Force or Army. Public health works in NIH, Native, like reservations, Native American facilities, then there's also the VA. Lots of opportunities out there, a lot of need. Any other questions?
Was it hard like staying in school for so long? Like since you have to stay in school for longer for like medical fields, did you ever think like, oh, I gotta be in school for like longer than everyone else and all that? Since you have
No,
to
but I
specialize.
noticed that now that you mention it. I was already an adult when I graduated from my associate degree, because I didn't go to college right away, because you know, it wasn't on my mind to do that. We had 5 semesters straight to get through the associate in nursing program, but we were getting transferred right away, so I pretty much had to finish it and get out because we were going somewhere else. And then the same happened with other subsequent transfers, because then I did my bachelor's in California, and then my master's I started in DC and finished in Alaska. So I felt like I was in school for quite a long time,
yeah.
because I was, but it was pretty well spaced out.
Oh yeah, that's
And-
good because you get like a break in between.
Yeah.
That probably felt better than having to just stay in school and just sit.
Yeah.
Yeah.
Yeah, it did,
It was
yeah.
probably
But,
better that
but
way.
I was doing things because I felt like I wanted to go further in my profession. So I could have just stayed with my associate degree and been in nursing. Okay,
Mhm.
but I would have missed out so much. Yeah, because it got more interesting, you know, the further I got into my education and how I could apply that. I was learning things that meant something and that were applicable. That you could actually take this and, you know, put a program together, help people better because I knew more. Because you don't know what you don't know until you learn it. If that makes sense. Yeah. Anyways, in my case.
I got one more question.
Okay.
So you said you're a psychologist, nurse. when you worked, did you ever work in a ward or any of that kind of stuff, or was it just strictly section of the hospital, or did you ever work in a separate
Psych unit?
psych unit?
I did, yes.
And was there
twice.
any, I mean, I know that might be a little more intimidating because, you know, you're female, so was there any that type of intimidation when it came to working in, or did you just work in a woman's unit?
No,
Or was
no,
it
no,
just
no.
co-ed?
I never worked just a women's unit. Actually, when I was in nursing school, did you guys ever hear of a movie called One Flew Over the Cuckoo's Nest? You ought to check it out. Jack Nicholson was a very young man. Anyway, in that movie, the conditions in the psych unit were pretty horrible, kind of in the 1950s, even before my time. But that's the kind of unit I trained in Connecticut when I did my associate degree. And so, even though I loved psych when I was in nursing school, it was the field that I was most interested in. Second of all was OBGYN, by the way. I thought I could never do this because people would stand around and be sort of catatonic, just stand there all day long, just stand there all day long, and it just felt so hopeless to me. And I thought, how can people get better? These people are not going to get better. So when I went into psych, sort of through the back door of being with the hotline, I started to understand how it was much more interesting to work with people who are in crisis. Because, yeah, today something has happened to you in your life, and you're very truly distressed, you're very traumatized, but people can and do recover from things like that, and so you can see how people would improve. And you never got that in inpatient psych, at least the way it was when I first learned. So, the second time, after I worked on the hotline and moved to Washington, D.C., that's when I worked at NIH, and we had an excellent preceptor program there, and took us from the basics all the way, to, sky's the limit. But basically, it was a unit studying depression and anxiety disorders and bipolar illness. And so, yeah, we had a locked unit for when people were weaned off their meds for experimentation purposes, because that's what NIH does. It studies drugs to try to understand what works and what doesn't work. But in order to do that, at some point you have to take people off all their meds and then kind of plug them into the research protocols. And even we didn't know if they were getting an active compound or if they were getting a placebo. You know what placebos are?
Yeah.
Yeah,
Sugar
so,
The
yeah.
sugar bills.
Yeah, basically. So, you had to be trained, you had to know what to do, how to decompress the situation, to calm it down, keep all the patients safe, but also to help people learn skills, because very often when you have a mental illness and you start to get better, you don't know how to get better. You don't know how to plug feeling better into your life so that you can start to make good logical decisions based on a process, not just, oh, this feels right, let me do it, and it turns out, oh, that was a bad decision. So they have to learn all these life skills again. So that's what we did. So, yeah, you have to work on a unit that has to be safe, and we learned how to do that. So, yeah, the other time I worked in patient psych was at Gorgas Army Hospital in Panama, and we had people in lockdown a couple of times. But by and large, because of the type of unit it was, we had active duty soldiers and sailors, men and women, all rates and ranks, and we just did what we had to do. But it was very interesting. Yeah. So you guys have your whole lives ahead of you. So I hope that you find something as equally as interesting and fulfilling, and because certainly when I look back, and I'm still doing new and different stuff for myself, to try to learn and expand. So I'm not completely out to pasture you guys.
Any other questions, guys?
You want me to stop?